The global nursing shortage is expected to worsen as the coronavirus pandemic enters its third year. According to the International Council of Nurses, many health workers have reported burnout from the pandemic in the last 2 years. So what does this mean for the health sector as the Omicron variant spreads? Well, let's discuss this then. I'm joined by Denosa, the nursing union's spokesperson, Sibongiseni Delihlazo, who joins us now for that conversation via Zoom. Mr. Delihlazo, thank you for your time. So there's a reported shortage of nurses globally, we are told, and the situation seems to be slightly better in countries that are well off and are able to recruit from poorer and middle income countries. But what is your understanding of the situation in South Africa now?
Well, good morning to you, Tulas, and to the viewers at home. I'm afraid the situation in South Africa is not different. If anything, it's much worse because as a country, we are just not getting the basics right when it comes to our healthcare system. For instance, we do believe that government needs to change its attitude towards the country's healthcare system and how it invests in it. We just believe that government is ignoring this sector, which is very key to even the economy, because it keeps on cutting the budgets in provincial governments. A small province by population like Northern Cape, for instance, has an experience of having a 600 million budget cut. And you can just imagine in other provinces. Now, this continues every year. We've got very few institutions of higher learning, which give a nursing program. Just before democracy, well, after democracy, soon thereafter, we had a situation in the country where our government closed many nursing colleges. In a province like Gauteng, for instance, we had 8 colleges. After the closure of some colleges, the Gauteng province remained with 3 colleges. In an instance where each and every year population figures keep growing up. So the situation in the country is getting dire by each year instead of actually improving. There are advices out there, even from the World Health Organization, on how this can be resolved. But I'm afraid we're not doing anything to follow such advice.
But given the fact that the last 2 years have revealed to us the importance of the various professions within the health fraternity, is there a sense that perhaps there's a sense of recalibration on the part of policymakers to say, hang on, we may have gone down this path of closing nursing colleges in the past, but actually we now need to have more of a focus in trying to recruit young people to enter this profession as well as retain experienced nurses?
Well, I'm afraid I wish I was quite optimistic, but I do not think that is the case in the country. If anything, we're just, I think we've just let our guard down as a country. Government doesn't, well, it is aware of the challenges. For instance, in 2011, during the State of the Nation address, former President Jacob Zuma announced in Parliament that the government was committing to refurbish and reopen all the previously closed nursing colleges, something which has not happened to date. And if you were to ask government as to how far that process is, I doubt if you will find anybody who will give you an update. Our concern is that instead of increasing our product of nurses each and every year, we are decreasing them. Institutions, for instance, that were taking about 300 students for 2020, you would find that this year they are taking 70 students. And that is obviously there's a curriculum change that needs some new requirements, and many public colleges are struggling to reach the bar. And that is a serious problem for the country, not even talking about the need to educate the nurses on the system into postgraduate programs like ICU nursing, theater nursing, trauma and the likes. So we are faced with a situation where currently, in order for us as a country to deal with the current pandemic, with its generations of variants, we have to take staff from other equally important service centers like mental health, TB and the likes, and redeploy them into dealing with the issue of COVID-19, which is very unfortunate because it's delaying another crisis that we are going to face soon after we're finished with COVID-19.
Sure. So while we are talking about this, I've seen reporting from MoneyWeb, citing various sources and talking about how there's this new recruitment drive by the wealthier countries. So they're citing the UK, Germany, other countries in Europe, and the US and Canada as, really upping their recruitment drive and mostly sourcing from the lower income countries. I thought this was a phenomenon of the past, of the mid-90s to the late 90s. Is this firmly back on the table? It would make sense for it to be, I imagine, given that, those countries are also dealing with their personnel needs within their own health systems. Are they now upping the drive to recruit from countries such as ours?
I'm afraid they are to us. In fact, I think as a country we should be very worried in South Africa, because in terms of our products of nurses that we produce in the country, they are well sought after by the world. And South Africa, of course, is once you study in South Africa, it's easy for you to ply your trade in the UK and many other countries. Now, the strategy from those countries has gone drastically instead of reducing to us. And of course, they've learned their lessons from COVID-19. I'll just give you an example of the UK. The National Health Services, which is their NHI, has actually advised even CEOs of hospitals in trying to ramp up their recruitment drive. They're advising that CEOs of hospitals must get onto the planes off to the developing countries and recruit nurses robustly. You can just imagine what that says to us, because in South Africa, we don't have a staff retention strategy that is in place. If anything, we just have pushing factors. We are going to be very vulnerable. Many of our skilled nurses are already leaving the country to us because there's nothing that keeps them in the country. If anything, everything actually just keeps them out of the country. That is a serious concern. We may not realize it now, but 10 years from now, the World Health Organization has estimated that the 6 million shortage of nurses that we're experiencing currently is going to be about 10 million in 10 years' time if every country does not increase its product of nurses by at least 8% a year.
So on that note,
which as a country, South Africa, we're not doing that.
On that note, Sibongiseni Delihlazo, as a parting shot, President Cyril Ramaphosa has tested positive for COVID-19. He's self-isolating in Cape Town, and one assumes he's got time to catch up on some of these issues. Using a language that he knows, would you say this situation is a quote-unquote burning platform? How much of a crisis is it, and what does he need to know, to the extent that perhaps this has not been brought to his attention, as well as really the fuller attention of policymakers and the minister, for example? What's the takeout message from the conversation you and I have had for the last few minutes?
Well, we could just plead with him. Fortunately, I think, as you mentioned, he has got a bit of time. We wish him speedy recovery as Denosa. We just wish that the government that he leads could really change its attitude towards healthcare system. We believe that our government is now seeing healthcare services and healthcare system in this country as an expense instead of an investment. There is no economy that is ever going to grow if the country's population is sick. If we don't invest in nursing, we do not stand a chance to even recover economically, because we still have long queues in our hospitals and our clinics. And in a day, you find that not all patients who flock into facilities get assisted. That is because of the shortage of nurses in the main, because nurses form majority healthcare professionals.